Hi, Professor Zach here. This is my last assignment other than the exams. This is chapter 20, question number 1 regarding the limitations of urinary tract infection risk in males and females. So obviously there are some anatomical differences pertaining to the urinary systems of males and females. To start, the female urinary tract is significantly shorter than a male's. Females also have a more straight shot from the bladder to the urethral opening, whereas males, on the other hand, have a trickier shape and their urethra is surrounded by the prostate gland. That's why when people or gentlemen with like prostate issues typically have urinary hesitancy or the inability uh, to go when they have prostate issues. Um, Another thing is that for males, uh, their urethra is not only just used for urine, but also seminal fluid excretion. So the male urinary tract is also part of the male reproductive system, whereas in a female, the urinary and reproductive systems are entirely separate. And here's a better view of the pictures from the previous slide. So how might we prevent UTIs? First, it's quintessential to note that women are diagnosed way more often than men with UTIs. For prevention purposes, women may need to urinate after sex, wipe from front to back to prevent spreading bacteria from the anus to the urethra, and refrain from using feminine hygiene products. Um, in general, all populations should drink more fluids, especially water. They should refrain from holding the urge to go for too long, keep blood sugar within normal limits, and take showers instead of baths to prevent UTIs. Far too often, UTIs are left untreated for too long, and this can lead to cystitis or pyelonephritis and even urosepsis, which can be fatal. Some experts suggest that drinking or eating cranberry containing foods regularly can keep the infection risk at bay. So the most common bacteria that has been found to cause urinary tract infections in women is E. coli, uh, E. coli is particularly important because it's commonly found in the GI tract. So there goes the wiping from, the mistake of wiping from back to front and spreading that bacteria. Typically, to diagnose a UTI, a provider will order a urinalysis, which is a comprehensive test that checks for an almost innumerable uh, number of disorders. Typically, the provider will check the acidity of the pH, the acidity or pH of the urine, as well as the color, the concentration of sugars or proteins, the presence of bacteria, blood, yeast, precipitates or solids, and some other things along with this order. The presence of bacteria in the urine or bacteriuria is indicative of an infection somewhere along the urinary system, which is causative of the UTI. And these are my references. Thank you for listening.